evaluating the efficacy. Oh, perfect. Evaluating the efficacy of aflibercept 2 milligrams Q8 compared to aflibercept 8 milligrams Q12 and aflibercept 8 milligrams Q16. These are the study design. All treatment arms receive 3 loading and then following on their randomization interval. In between, there are multiple timing opportunities to assess for what is called a dose regimen modifying criteria based on VA as well as CST. And if patients meet these criteria, then the retreatment interval will be shortened according to this protocol, and once shortened, they cannot go back again. Specifically regarding the PCV subgroup, we saw that in the whole study population of over 1,000, almost 300 patients had their ICG submitted. ICG was optional, so amongst these 295 cases that were submitted, they were read by the reading center, and PCV was confirmed in 139 cases. In terms of the ethnicity, you can see that about 2/3 were from Asian population and 1/3 from white population. In terms of baseline characteristics, these are relatively balanced between the PCV subgroup and the overall population. Specifically, the starting BCVA was about 58 to 59 letters. In terms of primary endpoint here, you can see that PCV subgroup on the left and overall subpopulation on the right-hand side. First, we note that in the 2 milligram Q8 week arm, these results are consistent with what we have learned from PLANET studies showing a good improvement in visual acuity. And now we look at the 8 milligram arms, and basically they achieved good visual acuity gain, which was comparable with the 2 milligram Q8. Further on, we'll compare the PCV subgroup with the overall population, and again, you can see very similar and comparable results. Overall, patients gained between 7.5 to 9.5 letters, reaching about 65 to 67 letters at the end of week 48. In terms of proportions who maintained their randomized dosing, we saw 87% in the PCV subgroup maintained on the Q16 week randomization interval, and overall population, we saw again 83% in fact, 87% among the PCV and 83% among the overall population, maintaining an interval of Q12 weeks or longer. In terms of other anatomical endpoints, first we want to look at the central subfield in terms of proportion with absence of fluid, and we saw numerically higher proportion in the PCV subgroup. In terms of the proportion or in terms of CST reduction, you can see very similar performance between the 8 milligram arm compared to the 2 milligram arms, and again in the comparison between the PCV group compared to the overall population, that's top to bottom comparison. Next, we are always very interested to look at the ICG-based anatomical results, and here in dark green is showing you the proportion of patients who had an absence of PCV on the ICG. You can see that at screening, this was almost none, and at week 48, this increased to 51% in the 2 milligram arm and to 49 milligrams in the all 8 milligrams. So the two dosages were comparable in terms of achieving polyp closure. And in terms of patients with inactivated polypoidal lesions, so despite the polyp being seen on the ICG, if there is no fluid on OCT, we call those inactivated polypoidal lesions, and you can see that the most of the polyps were inactivated, and those that are active dropped from over 90% down to about 20-something% in both the 2 milligram Q8 and all the 8 milligram arms. Similarly, reassuringly, because PCV may be juxtafoveal in terms of the polyp itself, we also saw a reassuring reduction in absolute macular volume in the 2 milligram and also the 8 milligram arms. In terms of safety, we saw no new safety signal, and there was really one mild case of IOI, and there were no severe cases of IOI observed. So in conclusions, we've run through and we've seen that amongst the patients with PCV, they achieved robust improvement in BCVA at week 48, whether they are treated with aflibercept 2 milligrams or 8 milligrams, and these results were comparable between the PCV subpopulation and the overall population. In addition, we saw a large proportion maintaining a long durability of retreatment interval, as well as fewer number of injections being needed. And anatomical results were also supportive of the visual function result. And finally, the safety profile was similar to what we've observed in the overall population. Thank you very much.
So since we don't have much time, I will invite Paolo Lancetta to talk to us about intravitreal